Early in my career, I was very focused on my clinical skills. I wanted to master the art of acupuncture. I wanted to know which herbs were going to help with this condition and what have you. And I wanted to make sure that I was as clinically effective as possible. What I realized after some time is that the clinical effectiveness of these modalities was made better or worse by someone's daily food and lifestyle choices. Another thing that I learned, that if I didn't get somebody on board with either their acupuncture regimen or their supplement regimen or their dietary regimen, that I wasn't going to have much success at all. A few years into my career, I embarked on a coaching program, and I did this because I realized that in order to help people achieve a greater state of health, I had to be able to connect with where they were emotionally and had to be able to give advice in a way that would be well received. In the coaching program, I learned a lot of strategic questioning that would help people really discover for themselves what was going on. A lot of the time in sessions, I'm not actually giving advice in the earlier parts. I'm really asking them questions about, how they're doing things and why they're doing things. And much of the time they're answering their own questions, and then I'm giving helpful advice with my expertise and what foods might be healthy for them and what acupuncture techniques might be the best fit for them, and maybe how to cater their acupuncture schedule with their doctor's treatment. What I learned is that working with patients is a collaborative effort. It's not just what I do with my needles or my herbs or my supplements. It's really how well I'm able to connect with that person and what they need emotionally and physically. As a result, the counseling skills actually ended up being a lot more important in some cases than the clinical skills. If you don't connect with somebody, you're not going to be able to help them. In China, there's a saying that you have to have yuan fen, which means destiny, with your doctor. That if you don't have that connection or that destiny, as they call it, with your doctor, then there's a good chance that they won't be able to help you. Which brings me to my next point. If you haven't found a practitioner that you connect with, try again. It doesn't mean necessarily that that modality doesn't work for you, that acupuncture doesn't work for you, that nutrition doesn't work for you. It might just be the fact that that person didn't fully get you. Find the person that gets you.